response with lithotripsy. We want no stone particles left behind. 105 stones were in the kidney, 135 stones were in the upper ureter, 51 down low in the distal ureter. Thanks, Gary. We were able to treat these stones in a single session 91% of the time. Those numbers have since gotten better, but we're interested in treating a stone one time and being done with it. Next. Obviously, the larger the stone, the harder it's going to be to pulverize it completely. In Rocky Mount, the average stone size is 11 millimeters. That's about half an inch. That's way too large to pass spontaneously. Stones in that size range we got rid of 90% of the time. Next. The last figure in this graph is the most interesting. In the lower ureter, 90% of stones can be completely gotten rid of with this technology. A lot of studies show that if you slow the machine down, sound waves have a better chance of breaking the stone. Our results parallel this. The second thing that makes the stone break is the... Hey, tell that guy to be quiet. The second thing that makes the stone break is the absolute amount of energy. You might think of the machine as having a volume control. And if you can turn up the volume, you'll get a better result. Next. So it turns out that the Germans engineered this device pretty much to match the typical stone size seen in Rocky Mount, eastern North Carolina. The beam of sound is 12 millimeters. Our average stones are 11 millimeters. Next. Something new we're doing in Rocky Mount that most physicians I know don't do is we're treating bladder stones. This guy has 6 stones in his bladder. He's not hurting, but he's got a lot of blood in his urine, and his urine stream turns on and off. The traditional way to treat a bladder stone is with a laser lithotripsy, which is like a piece of fishing line, trying to beat a stone up with that. With this device, we treated all 6 of this man's stones in a 40-minute period. Gary? And after the treatment, they're gone. We're proud to have this technology. We're proud that we were chosen to be a site to do the FDA trial. One reason they chose Rocky Mount is the local diet ensures we make a lot of kidney stones. We drink a lot of iced tea. We eat a lot of barbecue, a lot of salt. So y'all keep having those things. We'll make more stones. Thank you.
So, I'm Gary Robertson, an associate professor in the Division of Urology at Duke University Medical Center, and I'm specifically trained in urologic cancer treatments, having spent 3 years at the National Cancer Institute in Washington, D.C. And I'm very interested in reporting the Drive for Men's Health tonight to make you aware of this unusual condition which can affect all men at many different ages. Testicular cancer. And the first thing we need to recognize is the treatment for this condition has improved over the past 3 decades to where it is now the most successfully treated solid cancer in human history. And that came about because of research on different chemotherapy combinations, better imaging, and better awareness on the part of the general population. So my message to all men tonight is that testicular exams can be done, just as breast exams can be done by women, and can detect small masses in testes and achieve easy cures. So we think that with better chemotherapy and increased awareness and better imaging, we now can use multiple therapies at one time to achieve a better success rate. So the other message is we don't want you to be like Lance Armstrong. Not because Lance Armstrong represents any unusual condition, it's just that when he was diagnosed with testicular cancer, his disease was far advanced, even into his brain. Unfortunately, he survived very extensive therapies and has achieved a very long survival. So again, testimonial that testis cancer can spread from a very small site to all over the body and is an effectively treated tumor, but best treated and diagnosed when earliest in its smallest stage. So there's Lance celebrating not only his athletic endeavors, but also his testicular cancer survivorship. So what is it about testis cancer that's so unusual? First of all, there are only about 8,000 cases in this country of over 300 million per year. We have a small number of deaths annually, but that is achieved with a fairly extensive and aggressive therapy. And we know that we can achieve nearly a 95 to 99% cure rate. So we judge cancer survival in 5-year increments, and we can see that 96% of individuals have at least a 5-year survivorship at the time of diagnosis. And this is durable for a long-term cure. However, most of these tumors develop in young ages, between age 15 and 35. This is a young man's disease. There is some ethnicity difference, with white patients achieving this condition more often than black patients. We can see that over the years, however, this is a graph that shows 1975 to 2001, there's been a steady increase in the number of testis tumors developed in this country. We can also see by this curve that the red dots are for white patients, the blue dots are for black patients, and the yellow dots are for Hispanic, green for African, American Indian, and Asian Pacific and Islanders. And we see a peak around 35, but also we see another little peak around 70. So there is another peak around age 70. So the message is you cannot give up self-exam through your lifetime. We also see that the survivorship has achieved nearly 99 to 100% success rates over the past 3 decades. What a great success story. Now, in comparison to other tumors, the success for testis cancer is most pronounced in testis cancer, and also we can see the distribution of 5-year survivorships compared to other tumors. And we feel like the continued awareness will achieve this on a consistent basis. But our goal is to try to find these tumors at an earlier stage. So, as we talked before, early chemotherapy, better imaging, and multimodal therapy have been effective. The other issue is when we do make the diagnosis. Next slide, please. Keep going. Yes. We have to understand what were the risk factors. What prompted this early diagnosis? Well, we know that there are some conditions, genetic conditions, and particularly some young boys, when they're born, have testicles that are inside of their abdomen and then come out of the abdomen later in infancy. And when that does happen, there's an increased incidence of testis cancer. We recognize that there are some genetic conditions which will increase the risk, and any exposure to inflammatory conditions such as mumps, maternal estrogen exposure on the part of the mother, and some history for pre-malignant conditions that we can detect on biopsy may predispose. Next slide, please. These are examples, the next few slides, of blood tests that can be elevated and abnormal in testis tumors. And when the clinician will hear the story of some discomfort or an unusual lump, we'll always obtain these blood tests. These tests are predictable. They have certain levels of normally, and they will disappear from the blood once the testis tumor is treated. It's an excellent way to test for the residual amounts of cancer once a testis tumor has been treated. So we show you all of these particulars, these unique features of these blood tests. There are 3 basic blood tests which are commonly prescribed and examined. Next slide. This is actually a pregnancy test. So you might find it a little unusual that testis tumors in men will actually mimic the same condition as pregnant females. However, we also know that sometimes the test can be falsely positive and can actually be elevated in cases of marijuana usage. Next slide. Other general enzymes are indications of general presence of tumors. Other tumors will also express this protein, lactate dehydrogenase. This is just an example of medical testing that allows clinicians to better understand the full extent of a tumor and to measure the response to treatment. Next slide. So what should the common advice be? The common advice is to self-examine the testicle monthly, learn to know your anatomy, learn to feel for small lumps or bumps, and this should be a part of an annual physical with your primary care physician. We should also represent that painless lumps are more worrisome than painful lumps. So make sure that because something's there and it's not painful, that's not something to worry about. Next slide. So at the time of a testicular lump workup, the patient would seek an urgent physical exam, have an ultrasound exam, which shows excellent anatomy, measure the serum tumor, but it can be significant, it can be deadly. Testis tumors double in size every 30 days. So at the first sign of any lump on self-examination, it is recommended that all men seek medical attention. Thank you very much for coming out for Men's Health, and let's go for Men's Health.
Can I ask you a question?
Absolutely.
Thank you very much. They are very important information for us. After testicular cancer treatment, can patient have got a child?
Yes. Let's go to the next slide. Yeah, just keep going. So let me answer the question. I had a letter prepared to show you tonight from a patient who was very grateful because what actually happened is they decided to store their sperm prior to treatment. And that's a commonly, yes, this is a commonly recommended practice and is very effective. And actually every Christmas I receive Christmas cards from my patients who have fathered children from their stored sperm. Yeah. I receive Christmas cards every Christmas season, every holiday season, from patients who have fathered children from their stored sperm.
Thank you.
Excellent.
Can I ask other question?
Absolutely.
Uric acid ESWL, stone treatment.
I think Dr. Mathis should hear this.
Yes.
Yeah.
Do people feel pain in their back?
Do you mean do they feel pain during the treatment?
Yes.
No, they do not. Our patients are under anesthesia. It takes a lot of energy to break a stone. That would be painful if you weren't asleep. So our patients are asleep during treatment and they don't have pain. And they're just mildly sore afterwards.
Let me add a comment about lithotripsy because Dr. Mathis is being a little bit modest. This technology was developed during the early experimentation with sonic damage on airplane wings in Germany. This was a highly technical advance that came to this country in 30 years. But in the last 30 years, there have been only minor modifications to the lithotripsy devices. I think we're very fortunate to have had an enhancement to this device that is as effective as Dr. Mathis described, and is quite an achievement.
What happens when the lady, gets older? She has to take some more calciums for the bone not to be porous. At the same time, they end up into the kidney stones. So how to balance that act out?
So his question is calcium supplementation more likely to make you make kidney stones? And in fact, the opposite is true. If you went on a low calcium diet trying to avoid calcium intake, you would paradoxically make more stones as your parathyroid gland kicked into action. Our bodies know how to regulate calcium, and 1,000 to 1,200 milligrams of calcium a day is a good way to prevent kidney stones.
Are there any other questions for the doctors? Or one you would like me to answer? Can we give them a big hand for being here and taking the time to be here tonight? Yes, sir. And I just wanted to thank all of you again for coming out and thanking the Drive for Men's Health for doing this. Can we give them another big hand? This is incredible, this work that they did. Thank you again to the City of Rocky Mount, and I especially want to thank the Doubletree by Hilton Hotel and the Gateway Center staff. If you see them around, they've been here and they set all this up and they've been very supportive. So can we give them a big hand as well? Thank you all.
I think Jen wanted to keep music playing just until the doctors come back out, but that's essentially it.
Yeah, I think they're going to. She's going to start playing it.
I got you, thank you. Great job. I got your number. Yeah, I got your number. Okay. I got your number.
Right here, 1, 2. Yes, 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 yes. David, great job. Great job. I'll get these two.
Your dog take showers now?